Hello and welcome back to the Bearded Dentist. Today we will be doing a molar crown prep on a cracked tooth. So you can see this is tooth number 14, it's the upper left molar. And this tooth is cracked on the buccal as well as the mesial. The mesial crack isn't that deep and that bad, not as bad as this one on the buccal here. Um, but, you know, these amalgam or silver fillings, mercury fillings, whatever you want to call them, they're great in the sense that they last a long time. I don't take them out for the sake of taking them out unless the patient absolutely asks for it, and even then I kind of educate them. Removing amalgam is like removing asbestos. Um, the asbestos isn't all that bad when it's, there being insulation. Yeah, it's not great, but really the danger is the manipulation of it when you're removing it or installing it. Um, Same thing with these fillings. So if someone is concerned about mercury exposure, I always let them know, as you should, that your highest level of mercury exposure is going to be when you're removing these fillings. And so we always use a high volume suction to remove these fillings. And the other thing, the thing I don't really like about them is they crack the teeth. It's kind of just a metal wedge that's sitting in the center of your tooth there. And over time, and I've seen it on decades old amalgam fillings, that amalgam material does expand. If you've ever seen videos of mercury amalgamating with other metals, um, it does expand typically really fast. This expands over years and years and years, but it expands enough to start causing these cracks and fractures in the teeth that, sometimes literally split the teeth in half. So here I am, and I usually remove these mirror shots because it's just hard to see. It's so hard to get the focus on the mirror shots, but I kept them in this video. I kept this video a little bit longer. Didn't really edit out a lot of the um, kind of the stuff that I usually would. But anyways, whenever I prep a tooth with a large crack in it, I always prep that crack out as deep as I can, as far as I can. I try to remove as much of the crack as possible to stop the propagation of it. If I can get all the way to the end of the crack and remove it, remove that end piece, even if I can't get the depth of the crack into the tooth all removed without possibly hitting the nerve or irritating the nerve to the point where this thing's going to need a root canal. If I can at least get to the end of it, then that's a huge win because that's going to usually stop the propagation of that crack because we're going to contain it within the crown. That's the other thing. Whenever we have cracks like this on teeth, I do not do onlays, I don't do inlays, I don't do big fillings. That tooth is getting a crown all the time, every time, because I know, at least in my hands, the success rate is going to be that much better if this tooth has full coverage and that crack is never allowed to repropagate and and split the tooth, which is what we're trying to avoid. Crowns, when I do crowns, I'm doing them to avoid root canals, avoid splitting teeth. I want to keep that tooth in the mouth as long as possible. And that's true with any restoration, but a crown is really kind of that last opportunity to keep it in there. Fillings have their place, but I tell folks it's like a roof. If you have a big storm come through, a few shingles get damaged, um, 1, 2, 3 shingles. Sometimes you can just replace that, or smack them back in, or do a quick little whatever. But if half of your roof gets blown off, or even a quarter of your roof, or even a section of your roof gets completely destroyed, then you can't patch that. You have to replace the entire roof. And that's the same concept with a crown. When we're missing, if more than 50% of that tooth is going to end up being plastic, which is what filling material nowadays is. Composite material is simply plastic. Um, if over 50% of the tooth is going to be plastic, then I know that tooth is going to have a much better prognosis. It's going to last a lot longer if I just put a crown on it. And eventually, it's going to save the patient money. because if I do a huge filling on that tooth, in 5 years they're going to need a crown on it anyways. And why do I say that? Shouldn't you hope your fillings last longer than that? Well, sure, but I also know how physics and the chemistry of these things work as well. The bigger the filling, the greater the shrinkage, more leakage, all of that other stuff. And if you're replacing such a large surface area on a tooth that gets beaten up all day long, especially in someone that grinds, or someone with just huge jaw muscles, someone that's got a lot of stress, stuff like that, that filling is going to wear down. It's going to start debonding. It's going to start leaking within a couple years. I've seen it. I've seen beautiful fillings on patients that do, have very good hygiene. And still, after a couple years, you start seeing a little bit of leakage, a little bit of cracks and breaks inside of those fillings. And now the patient's got to pay for a crown anyways. So you're not doing them any service, in my eyes, by putting huge fillings in there. Onlays and inlays, sometimes I'll do those. But if there's a crack, in my eyes, it needs full coverage to give that tooth the best possible chance at not propagating that crack further. As you can see here, as I'm prepping the buckle, we've gotten to the edge of that crack. And I'm able to prep past it and prep past the part of the buildup that I've put in. And so, to me, that's a success. I don't think that this tooth is going to crack anytime in the near future. And if it does, that's the other thing. Even if you remove unless you remove 100% of a crack on a cracked tooth, there's always the possibility that it can continue to propagate through the tooth later. But the more of that you can reduce, and if you can get to the end of it, then the better chance you're going to have of that not happening. But I always tell the patient that once a tooth is cracked, unless I can absolutely 100% remove all of it, which isn't usually the case, sometimes they go pretty deep, especially on stubborn patients, because this tooth here, actually no, this patient I told, she got this done about a week after, because I saw her for a full exam about a week ago. But anyways, a lot of patients, you'll show them these cracks and, oh, this tooth never bothered me. I've had that filling for 20, 30, 40 years. Okay. And it's 3 years later, and all of a sudden, I'm starting to get a little zing here. It's a little sensitive when I bite down. Well, that crack's now 2, 3 times the size, and that reduces the prognosis. But anyways, here I'm on the lingual, or the palatal, if you will. Usually I bring the margin all the way down to make it equigingival, equal with the gum line. But here, because this side of the tooth was so pristine and had no issues and the enamel was really healthy, I didn't feel the need to bring it all the way down there. This patient has 0 cavities in her mouth, very good hygiene. Saw almost no bleeding when prepping this. Sorry about the camera right here. But so I decided to keep the margin a little bit higher than the gingival tissue so it can stay clean. I try to give some good shots here to show you what kind of basically a finished crown prep looks like. This whole video is about 12 minutes long. That's about how long it takes me to prep these, and that's including adding the buildup and all that other stuff. Some of the major things I do is I'm always checking and rechecking. So right here I'm checking to see, are there any weird areas on the corners? The corners are always where you're going to get some either undercuts or some discrepancies in the margin where you didn't, because it's really hard to round the corner on a tooth and also press into the tooth with the same exact pressure you're putting on the straight axial walls of the tooth. So I'm always checking and rechecking and making sure I can get around those and keep a nice clean margin. Because if your crown's going to break, that's typically where it's going to do it. If you have a kind of a wavy, if you will, axial wall there, because it gets thicker and thinner as it goes around the corners. You don't want that. Something I always do every time is round the edges, and I'll round the edges 3 or 4 times. because sometimes I'll go back and fix everything up, but I always want to make sure I'm rounding the edges, because if you don't round the edges, then stress will concentrate there, and that's going to be another breaking point. So right here you can see there's a little lip of enamel, and what I like to do is take this little needle nose burr and grind that right between and just remove that little edge. And that right there is going to make the distance between the crowns just that much more to make it way easier to seat. It's going to make your contact is going to be so much better. Your lab's going to love you for it because they're not going to make this big stupid oblong contact. That's going to be really hard to draw properly. So I just did a bite test, had the patient bite down. I couldn't see between the teeth, so I'm using my barrel here, some call it a diamond. Excuse me. I call it a barrel to remove the occlusal surface. And every time you remove the occlusal, or take a little bit off of that, then you just resharpened all those edges. So you got to go back and you have to round those off. Now I'm not sure if I do that here right away because I'm probably going to check the bite again. And sometimes I'll use that barrel to round the edges because here I am checking the bite again. Bite looks pretty good, but not exactly where I'd want it to be. So I remove a little bit more in one or two spots to make sure there's no kind of wavy areas. They teach you that with ceramic crowns or zirconia crowns, milled crowns, you can just lop the top flat. Absolutely not. I always do an indent in the center and try to follow the natural contours of the tooth. It just makes for better crowns, stronger crowns. You give the lab more to work with, more to be able to make it look like the tooth next to it, so you're not putting a flat tooth or just a really ugly, tooth next to all these other natural teeth, especially with something like this. So I always depress down a little bit down the center line, mesial distal of that tooth. Anyways, thanks guys. I appreciate you watching. If you like what you saw, please like and follow. If you didn't, let me know in the comments, and have a great day.